Welcome to Integrating Ketone and Glucose Monitoring for Optimized Diabetes Management. In clinical practice, there is a need to increase awareness of the risk of diabetic ketoacidosis, otherwise known as DKA, and put in place the necessary steps to prevent it from ever happening. Hello, I'm David Kerr. I'm a UK-trained endocrinologist, but for the past decade, I've been living and working in Santa Barbara, California. I'm currently a senior investigator at the Center for Health Systems Research within Sutter Health. I'm also the digital health lead for the Diabetes Technology Society. Welcome to this program. Diabetic ketoacidosis is a serious and actually often life-threatening complication of type 1 and sadly type 2 diabetes. However, it's entirely preventable. We know some key facts about DKA. DKA is the first presentation of type 1 diabetes in young people, occurring up to 20% of new cases of type 1 diabetes. It also, sadly, is increasing in type 2 diabetes. DKA is also inequitable. It has a disproportionate burden affecting underserved populations in the United States and around the world, and in those who cannot afford healthcare through insurance. As I mentioned, DKA can be deadly. It's also expensive. In the United States, we estimate that a single episode costs almost $30,000. And if you look across the country, the annual cost is around $5 billion. Unfortunately, rates of diabetic ketoacidosis are on the rise. And the question is why, and what can we do about this? Awareness of the risk of DKA at the time of diagnosis of type 1 diabetes is suboptimal. There are too many people developing type 1 diabetes who first present with an episode of DKA. Moreover, for people with type 1 and type 2 diabetes, they often do not have access to the tools and the education that can prevent the full-blown clinical picture. The education is around what we call sick day rules, what to do when you have an infection, for example, and importantly, the technology to measure ketones. This is going to change, and that is good news. The other good news is that they will soon have access to better technology and more effective education for people with diabetes, for family members, particularly of young children with type 1 diabetes, and clinicians involved in diabetes care, not just specialists, but importantly, primary care, who are often the people who see individuals developing DKA. Our aim with this independent medical education program is to provide you with updates on DKA, including the latest research, what international evidence-based guidance is telling us, as well as improving our understanding of the pathophysiology, and most importantly, new innovations in ketone monitoring. We hope that this will have direct benefits for your clinical practice. In this education program, we will cover a variety of topics. What do the recent guidelines tell us from the perspective of primary care? How do we identify those people who are at particular risk of diabetic ketoacidosis? How can we use state-of-the-art technology to help people monitor the ketones? To do this, we will share examples using common clinical scenarios. And the overall aim is to help you to lower the barriers to effective prevention of diabetic ketoacidosis. We'll also share a masterclass, which will include a podcast and a digitally delivered learning experience that you can access easily and at a time that is best suited for you. Later on, we will also share the latest breaking news around the topic of ketone monitoring from the American Diabetes Association annual meeting, which is due to take place in Chicago in June of this year. So welcome to Integrating Ketone and Glucose Monitoring for Optimized Diabetes Management. We look forward to working with you to make DKA a thing of the past. Welcome.